In the high-stakes world of football transfers, a player's medical examination can make or break a deal. There have been notable instances where a transfer was scuttled due to a failed medical. For example, in 2018, French striker Loic Remy's transfer to Liverpool was aborted due to concerns over a cardiac issue. These cases underscore the critical importance of the medical in the transfer process. So what exactly happens during a football transfer medical? Here is a deep dive into the procedure and checks that players undergo before a transfer can be finalized. Before the player even steps into the clinic, clubs often conduct a preliminary assessment. This might include reviewing the player's medical history and obtaining reports from their current or previous clubs. The goal here is to identify any pre-existing conditions that might warrant closer scrutiny into the actual medical. The medical begins with a general health examination. This involves checking the player's vital signs such as heart rate, blood pressure, and respiratory rate. Blood tests are also conducted to check for any underlying condition that might not be immediately visible, such as anemia or infections. One of the most crucial aspects of the medical is the musculoskeletal examination. This involves assessing the player's bones, muscles, ligaments, and tendons. The club's medical team will check for any previous injuries like ligament tears or fractures and assess their current state. They will also evaluate the range of motions in the player's joints and the strength of their muscles. Special attention is given to areas of the body that have been previously injured, as these could pose a risk for future injuries. Given the physically demanding nature of football, cardiovascular health is paramount. A cardiologist often conducts an in-depth heart examination, including an electrocardiogram and an echocardiogram. These tests help detect any potential health abnormalities that could endanger the player's health during intense physical exertion. In some cases, a stress test may also be performed to assess how the heart responds to physical activity. Imaging tests such as X-ray, MRI scan, and ultrasounds play a crucial role in the medicals. These tests allow the medical team to take a closer look at the player's internal structures. MRI scans in particular are useful for detecting soft tissue injuries, while X-rays are typically used to identify any bone abnormalities. In addition to the medical examination, clubs may also put players through fitness tests. These tests are designed to assess the player's overall physical condition and determine whether they are fit for a game. This might include running on a treadmill, performing agility drills, or even playing a small-sided game to evaluate their endurance, speed, and agility. While less common, some clubs also conduct psychological evaluations as part of the transfer medical. This can involve discussions with a sports psychologist to gauge the player's mental resilience, ability to handle pressure, and overall mental well-being. This aspect is becoming increasingly important as clubs recognize the role mental health plays in a player's performance. After all the tests and evaluations are complete, the medical team compiles a comprehensive report detailing their findings. This report is then presented to the club's management and coaching staff. If the player passes all aspects of the medical, the transfer is given the green light. However, if any issues are identified, the club may choose to renegade the terms of the transfer, delay it, or in some cases, cancel the deal altogether.